The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here talking to Dr. Viola Vaccarino, and Viola is the professor and chair of epidemiology and professor of medicine at Emory University, and she's recently published a very interesting paper in JACC that deals with the relationship between inflammation and microvascular function. And to carry out this study, interestingly, she was able to get 180 pairs of male twins, and they measured inflammatory markers, simple white blood cell count, CRP, and also adhesion molecules. And in terms of microvascular function, they measured coronary flow reserve by PET, defining normal coronary flow reserve as a 2.5 to 1 increase. And what they observed was very, very interesting, and that was that if, in fact, you had a low coronary flow reserve, that was associated with an increase in the level of inflammatory markers, and vice versa, of course, demonstrating clearly an association between inflammation and impaired microvascular function, coronary flow reserve. So, Viola, let me ask you, why should we care about microvascular function?
Thanks, Tony. As you just said, microvascular dysfunction is probably one of the earliest markers of coronary artery disease, and therefore it's potentially preventable. So that's an important reason why we should understand this phenomenon. The second reason is that understanding the coronary flow reserve and the mechanism behind it may be helpful in really have a clear picture of what the pathogenesis, pathophysiology is of coronary artery disease. And because it's something that's very difficult to measure it's not easy to measure with non-invasive techniques. It's not being really evaluated extensively, particularly in individuals without symptoms of coronary artery disease.
So can you tell me, was this mediated through risk factors? Is it a fact that if you have elevated risk factors, you have more inflammation and therefore more microvascular dysfunction?
Well, coronary flow reserve is thought to be related to coronary risk factors, and actually coronary risk factors are believed to be major determinants of coronary flow reserve. But our idea was really to see whether inflammation is the underlying mechanism behind coronary flow reserve, even after you control for coronary risk factors. Because that's already known, that the flow reserve is related to risk factors. We really wanted to know whether inflammation in itself is a driving mechanism behind coronary flow reserve and microvascular dysfunction.
So should we incorporate the measurement of inflammatory markers in the risk assessment of patients?
Well, as I said before, we were interested in understanding the mechanisms behind coronary flow reserve after you take into account traditional risk factors. So I don't think the time is there yet to recommend widespread screening of patients with inflammatory biomarkers or with coronary flow reserve just based on our findings. But I think that potentially, as research continues and more data are accumulated on this phenomenon, we could come up with specific information that may help us identify specific subjects, specific patient subgroups, which may benefit from an early assessment of their coronary function. And because that could also lead to earlier initiation of preventive measures, for example. and therefore more effective prevention.
So very, very interesting. Evidence that early in the course of potential atherosclerosis that inflammation is playing a role in microvascular dysfunction, and perhaps giving us a clue that sometime in the future we may want to apply anti-inflammatory agents. A lot still to be defined. Thanks very much for being with us, Viola. For Inside JACC, this is Tony DeMaria.